Hi, my name is Marie. I'm here to do your physical assessment today. Can you go ahead and tell me your name and date of birth?
Mark, February 29th, 1972.
Patient appears to be alert and oriented. Patient is sitting upright. Patient appears to be overweight. Patient appears to be well groomed, and I'm going to go ahead and assess the patient's skin. Patient appears to have tattoos, but no other abnormalities noted. I'm going to assess the patient's head. Patient's head appears normal. I'm going to go ahead and palpate for any abnormalities or lesions. No abnormalities or lesions noted. Patient's face appears to be symmetrical. Can you go ahead and smile for me? Stick out your tongue. Patient's face symmetrical, no drooping noted. Patient's teeth intact. I'm going to go ahead and I'm going to assess the patient's eyes. I'm going to go ahead and assess the sinuses first. I'm just going to palpate your sinuses. Any discomfort?
No.
No discomfort noted. Now I'm going to go ahead and assess the patient's eyes. The patient's eyes, pupils appear to be around 2 millimeters, equal, bilateral. Patient's, yikes. I'm going to go ahead and just have you stay right at me. I'm going to assess your pupils. And go ahead and just look straight ahead. Patient's eyes are round and equally round, reactive to light and accommodation. I'm going to go ahead and have you follow my pen light. I'm going to go ahead and assess the patient's conjunctiva. They appear to be pink, moist, no drainage noted. Patient's sclera are white. I'm going to go ahead and do a visual acuity. I'm going to have you cover your right eye and read the top line for me.
HV2DSN,
I'm going to have you cover your left eye and read that bottom line for me.
CVKDSR.
Patient does not wear any corrective or contact lenses, and visual acuity is intact. Now I'm going to assess the patient's nose. I'm going to palpate the nose for any tenderness. Any tenderness?
No.
No. Patient does not appear to have any drainage. Nose is midline. I'm going to assess the patient's ears. I'm going to palpate any tenderness.
No.
No drainage noted. Ears appear to be symmetrical. No deformities noted. I'm going to assess the patient's mouth. Go ahead and open up and say ah for me. Patient's mouth appears to be moist, pink moist.
Mama.
I'm going to go ahead and let the patient's tonsils are in place, uvula.
Mommy, just find this.
I'm going to go ahead and assess the patient's neck. I'm going to assess the lymph nodes. I'm going to palpate posterior occipital, mandibular, and clavicular. Any tenderness?
No.
No. Patient doesn't appear to have any abnormalities. I'm going to assess I'm going to go ahead and have you push up against my hands. I'm going to check range of motion. Go ahead and lift your arms up above your head for me. Patient appears to have good range of motion. I'm going to check cap refill in the patient's fingers. Cap refill is less than 3 seconds. I'm going to check the carotid pulses. +2 bilateral. Now I'm going to check pulses. +2 bilateral. Now I'm going to assess the patient's back. I'm going to walk around here. Patient's back, I do not see any abnormalities or deformities. I'm going to percuss. normal limits. I'm gonna check for firmitus. I'm gonna go ahead and have you say 99 every time I touch you.
99, 99, 99, 99.
Okay, within normal limits. I'm going to do this. I'm gonna go ahead and auscultate patient's lung sounds. Deep breath. Patient's lung sounds are clear in all fields. I'm going to listen to the patient's lung sounds in the front and on the side. Now I'm going to go ahead and palpate the patient's apical pulse. I do not see any deformities or abnormalities noted upon inspection. Feels to be within normal limits. Now I'm going to go ahead and listen to the patient's heart sounds. I'm going to listen to the aortic, pulmonic, Erb's point, tricuspid, and mitral. And I'm going to turn and listen with the other side. Heart sounds are within normal limits. S1, S2 heard, no murmurs noted. I'm going to go ahead and assess the patient's abdomen now. I'm going to go ahead and have you lay back for me. First, I'm just going to inspect. Patient's abdomen seems to be round. I'm going to go ahead and listen to auscultate the bowel sounds in all 4 quadrants. Patient has active bowel sounds in all 4 quadrants. I'm going to go ahead and percuss. Then I'm going to palpate, and you let me know if there's any tenderness at all.
No.
Alright, I'm going to palpate again. Any tenderness?
No.
Okay, you can go ahead and sit up for me. I'm going to assess the patient's legs. There is a scar noted to the left leg. Patient had a previous injury and surgery. I do not see any other abnormalities. I'm going to go ahead and feel patient's pulses, the posterior tibialis and dorsalis pedis, +2 bilaterally. Patient does appear to have some varicose veins also. I'm going to go ahead and I'm going to check for cap refill. Patient has good cap refill bilaterally. I'm going to do range of motion in the leg. I'm going to go ahead and have you lift your leg up for me, and I'm going to adduct and abduct. And then I'm going to do the same thing with the left leg and adduct and abduct. Any pain or discomfort with that?
Nope.
Nope. Okay, you can go ahead and sit back up for me. Now I'm going to assess neurological function. I'm going to go ahead and I'm going to go ahead and put your arms out. I'm going to check for cerebellar function. Go ahead and do it a little faster for me. Very good. Now I'm going to check reflexes. I'm going to check the I'm gonna go ahead and check we'll do these first. I'm gonna check patella reflexes. I'm gonna go ahead and check the Achilles reflex. And then I'm gonna go underneath your feet. Patient's reflexes appear to be within normal limits. I'm going to go ahead and I'm gonna have you stand up for me, and I'm gonna check your gait. I'm gonna go ahead and have you face that way and do heel to toe for a few steps. Okay, and go ahead and come back. Patient appears to have a steady gait. I'm going to go ahead and close your eyes and put your arms at your side. I'm checking balance. Go ahead and stand on one foot. Go ahead and switch feet. Patient's balance appears to be within normal limits. I'm going to go ahead and, I'm going to assess your back. You can put your arms at your side. Patient's spine appears to be midline. Go ahead and bend over for me. Okay, go ahead and stand up. Patient's spine midline. Go ahead and move your body side to side for me. Any difficulties?
No.
No? Okay, that appears within normal limits. I do not see any abnormalities, lesions on the back. I'm gonna go ahead and have you sit down, and I'm gonna, for neuro, I'm gonna check your sensation. I'm gonna use a cotton ball, and I'm gonna have you tell me where I'm touching you.
Left cheek, right cheek, left arm, right arm, left hand, right hand, left knee, shin, right shin.
Very good. Patient's senses within normal limits. That concludes my physical assessment. And do you have any questions for me?
No.
Nope. Thank you very much, sir. Have a good day.